30-year-old white male comes in after a brief focal motor seizure in his right arm. He doesn't have any other significant history, doesn't really smoke, and on his exam, he's intact, except he has a little bit of weakness in his right arm. Sensation is good, no signs of upper motor neuron problems. So where's that lesion at? Left parietal lobe. Any other suggestions? Where's primary motor cortex? All right, I see left frontal lobe. Okay, good. So here's a brain MRI. So across the top, you're seeing the axial, coronal, sagittal views, T1 with contrast, and you see somewhat similar type picture as the last time. So somewhat ring enhancing, a bit more heterogeneous. There's some surrounding hypointensity, which is probably edema. And then I threw in these pictures on the bottom of the slide that are slightly off from the tumor, just to give you an idea of what critical anatomy is nearby. So here on the bottom left, you can really appreciate where primary motor is, primary sensory is. On the other side, it's a bit swollen and edematous, so it's a little bit harder to see, but it's pretty clear where it is. So that lesion is tucked right under there. So what eloquent structure would be near this lesion? Well, primary motor cortex, primary sensory cortex, the descending cortical spinal tracts, the ascending somatosensory tracts. Differential, I think, would be similar to the last one. And the next steps, I think, would be similar to the last one that we talked about. Whoop. So this is what this patient's tractography looks like. So again, what does the blue represent? So if somebody throw that in the chat there, the blue pathway is cortical spinal tracts. What about the green? What do you think the green represents? So the green, look, it's in the left hemisphere. It's kind of cupping, or where you might think about the sylvian fissure. So the green represents the arcuate fasciculus. So based on that, you know that the lesion is resectable. The next question is, do you think the patient has to be done awake so that you can monitor speech throughout the surgery? And that's a good question to think about. Nobody would fault you with doing that surgery awake.
Hey everyone, Ryan Rad here from Neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.